Hello and welcome to another episode of 10x Hacks for Startup and Venture Success. This is your host Veera Patil, and today we are listening to part 2 of the podcast with Uttam Ramamurthy of Cerner India Corporation, and he is at the forefront of cutting-edge AI research on NextGen AI platforms. In the last episode, he spoke about challenges related to data curation of unstructured and structured data, privacy and explainability issues. In the current part of the podcast, he addresses exciting avenues in healthcare on voice prescription, on COVID use cases, and a lot more. So let's get started.
That becomes the starting point of it. So that's how the platform makes it easy for you to consume a data which is unstructured and at different places. You bring it together, you make it into a normal structured format and make it easily available for them. So this is where I'm talking about the complexities which we are trying to make it easy for any consumer. Here the consumer is my data scientist or a data analyst who wants
Right.
to work on the data and draw insights out of it. So
Right.
this looks, I talked to you in 2 minutes on this, but in reality, it's very scary, right? I have a different pipeline for my Word documents. I have a different pipeline for my images. I have a different pipeline as to how I want to process a video which is coming in. And
Right.
yeah, and each one has a different challenges and different limitations which goes with it. So that's where that's from a platform perspective, but from an EDA perspective, right? Drawing insights, right? I can have different lenses put to that same data. The way I
Right.
look at it, I can
Right.
visualize the data in different ways to give me different insights to it, right?
Right.
And I'll give a very simple example, right? Like we do a lot of hospital work, right? So emergency department is a very scarce resource we want to manage and make it more effective, right? We want to know how and what resources are needed at what time. And it's when we are talking about emergency department, it's we don't even think sometimes that a weather data would be a very good input for us to identify
Yes.
how we model the emergency department, right? So identifying that weather plays a key factor for the number of visits which happen on a given day in an emergency department needs some research to be done, right?
Yes.
I'm just taking one example there. So these are the kind of exploratory explorations that needs to be done on that data. That takes a lot of time, because once we get that data, that we know that these are my influences for this
Yeah.
particular output which I'm looking at, it's very easy for me to take it forward and prepare a model for me on that. So that's what I was talking about, the EDA part.
Thank you for listening to the podcast 10x Hacks for Startup and Venture Success. This is your host, Veera Patel. I'm bringing you interviews of investors and founders from Silicon Valley and across the globe. This podcast takes a lot of time and effort, so please support this by liking and sharing this post and signing up and subscribing to my podcast and my LinkedIn page on 10x Hacks. Thank you very much. You did mention about automation of AI. That's kind of scary. you know, Automation for AI is scary for me because I'm not truly convinced about deep learning. It's just a very reward centric learning.
Mm.
There is little bit of non-human aspect to it. So like it's a machine driven, reward driven. Where does human come into play in this AI automation? The explainability, the data bias, the predictability. These are scary waters. So
Yeah,
can you tell me a bit about that?
yeah. I think I take a different approach to it, right? Like what you're talking about could be a complete automation, right?
Right.
For me, it's a different perspective. What I feel is there are knowns and there are unknowns. The
Right.
unknowns is the thing which you are talking about right now, which we have no clarity about it, or we are developing the clarity on it. But what I'm concentrating here with the automation AI is where we have clarity, right?
Right.
And for example, I'm just saying that automation is, there's a lot of process in ML where we do repetitive tasks. We do it
Right.
again and it
Right.
is not reaching a stage where I'm going to implemented in such a way that it's going to be impacting a life or death kind of thing. So there is
Right.
a lot of scope and there is a lot of phases. So if you look at it, I was talking about different phases in which we are going to automate them. It's not there yet. So,
Right.
but that doesn't mean that we should stop or we should not even do that, right? There's a lot of scope for us. For example, I talked about the EDA, right? It's a repetitive process. There's a lot of steps within that I can just automate it, wherein the what they did manually to get 4 different lenses of the same data, I can automate for them that they click a button, it automatically comes. But looking
Right.
at the lens, interpreting that and choosing what is the right one for them, it's human still,
I
right?
see. I see.
But
Yeah.
now we have something called as reinforced learning. So
Yeah.
whenever that user is actually selecting one, we are capturing that data, which becomes an input for us to automate that in the future. But
Got it.
it's a phased way. So even I'm
I
scared, right? To be automated, it's pretty scary there. But it's going to happen over time. It's not going to happen right away. Yeah.
Yeah. So this is nice. Like you're doing it in pockets and you have human intervention in the right places. That
Yeah.
sounds pretty reassuring. But, uh, it's such a huge challenge to please the FDA or your health authorities about this because they come from the medical world, medical devices world, and AI is like probably like a software as a device or something like that. So, you must have faced a lot of challenges. So, you want to talk about some how you dealt with them and what it's like out there?
I don't want to go into details part of it, but I agree with what you're saying, right? Like, for example, not an example, that's the reason healthcare adoption of new technology is always slow
Right.
because I don't complain on it. It's needed, right? You need regulations because it directly deals with life, and
Right.
so it we need to be very careful and how we want to progress it. That again comes back to my other talk that we can't neglect the growth and the changes that we need to do for it. So
Right.
what we are looking at is even though we are slow adopters of new technology, but we are adopting and bringing it. Like for example, what you said, right? FDA approval for maybe one of my AI inventions may take 5 to 7 years,
Yes.
right?
Yes.
With the ever-changing world where we live in, 5 to 7 years is like ages for us, right? It's a long time that we bring in a new innovation to the end consumer of it. So there are challenges with that, and I think it's not just a problem for us. It's a problem across healthcare, and there are a lot of leaders who are taking this up and going and trying to see can we reduce the time, but still keeping safety at the center of all these things. So
Right.
I think one of the other concepts which I wrote about it is the explainability there, right? So
Yes.
what we are trying to build is how do we bring this change, right? Like uh, even doctors, nurses whom we work with day in and day out, they don't like these kind of changes. It's very scary for them, like you said that, right? And
Yeah.
convincing them or giving them the visibility to showcase how it's going to make their life better. So one of the key things in healthcare is the physician burnout, which is a
Mhm.
key focus area that we are trying to solve with a lot of AI capabilities that we want to build in. So
Right.
I believe that, right, from a personal point of view, if I show value to you, to any consumer, I mean to say, so if I showcase how your life can be better if you adopt the new changes which I'm talking about,
Right.
it's not going to be a resistance for it. It's
Yeah.
just that that clarity,
Yeah.
that understanding of what we are trying to make them adopt is needed, and that's where explainability is coming to a bigger picture, wherein if I say that this patient is a high risk for diabetes, right, that is just one statement, nobody believes me. But if I say that these are their vitals which are driving my prediction to say that they might become the level 1, level 2, level 3, right, diabetics for that part of it, it gives a lot more confidence for the physician to take my suggestion, right? So we are at a stage where we are suggestive right now. We are not, we want to be prescriptive, but it's going to evolve, right? That is the phase we want to go in, wherein we prescribe things wherein still a human intervention happen to bring it into effect. But
Right.
even reaching a stage, right? Like we are doing a lot of innovations with voice, right?
Mm,
Like if I and you are talking, right? Like we can virtually define the action items which came from our conversation. What were the goals? What were
right,
the main activities that we captured with that? And what are the
right,
follow-ups we needed for it? For example, I think in CHC, our company is going to present our new voice scribe, virtual scribe, which we want to bring in, wherein if a physician is doctor to a patient, all his vitals, his conditions, his prescriptions, everything can be captured, automated. That once I know that this doctor says that you need this prescription, I have an order ready for him of that
right,
particular prescription. He just clicks on it. He accepts it or he rejects it, both ways.
right,
And it
right,
goes forward. So this reduces the physician burnout drastically. So
right,
if you look at my blog, I talk about a stage wherein I don't see any hospitals in near future who don't have some part of AI embedded into the way they interact with the systems, EMR or the EHR. It's going to maybe US will, or the European nations are going to adopt it faster at a different rate, and the developing, or I think India is a developed country right now, so we are going to start adopting it different routes for it. Like I think COVID is a very good use case. I want to talk
right.
about it.
Yeah, go ahead.
The yeah the teleconsultancy, right? It became a huge hit, and the startup companies did that. So this is again the say a scenario where I'm talking about people have to be futuristic. They have tools for it, but the consumption happens with the maturity.
Right,
COVID forced that maturity.
right. Thank you for listening to the podcast 10x Hacks for Startup and Venture Success. This is your host, Vida Patel. I'm bringing you interviews of investors and founders from Silicon Valley and across the globe. This podcast takes a lot of time and effort, so please support this by liking and sharing this post and signing up and subscribing to my podcast and my LinkedIn page on 10x Hacks. Thank you very much. So
So
what's going on in telehealth? You seem pretty excited. Out here, there is a big surge in telehealth. People are online, consultancy, training, and the gym instructors are coming online. The gym equipments are at home instead of going to the gym. They're buying
yeah,
equipment. Trainers come on, and what's going on with telehealth in India?
yeah, I think we are slowly adopting it. I think we are having a lot of physician consultants right now. But I think it's a it's easy to have a technology which
Right.
supports telehealth, which we already have, I think, at some level. But
Yes.
it's the adoption, right? So,
Yeah.
for example, I think you would believe in India, we are all self physicians, right? We know certain level of medicines that we want to take, right? And there's a lot of risk with that. But I'm just saying that the kind of adoption and the way it takes, it's going to take some time for it. But um, telehealth is just a small part of it. It's
Right.
the IoT we talked about, right? Like how interconnected this healthcare providers come together and
Right.
provide a solution which shifts completely left towards a patient is the
Mm-hmm.
bigger story which I feel is going to change, right?
Yeah.
It's not just a interaction with your physician, right? I can take it a little bit more ahead for just thoughts like as soon as a physician prescribes a medicine for you, let's say in the morning for afternoon, right?
Yeah.
If we have a provider for Medicare who accepts your insurance
Mm-hmm.
instantaneously, which can
Mm-hmm.
trigger an order to get the medicine, and you
Mm-hmm.
have an ecosystem which is like a supplier, like integrated with the supply chain, who delivers you the medicine right by the time you have to take that medicine. It's a
Right.
great place to, right? It's
Yeah.
it's it's the evolution that we are looking at. So there's a lot of opportunities and a lot of new areas that we are working with. I think
Yes.
that is very exciting for me to look at it.
Yeah, this is an amazing vision you shared just now. Amazing, truly. I've heard a few pitches here in the US. It's coming from some doctors at Harvard. They've talked about startups like this. They work in pockets, work with insurance and the pharmacy and the doctor and the patient. So, but you're coming from engineering background. It's very enchanting to hear that from you. You're thinking like a doctor here, literally.
Have to put ourselves in the consumer point of view, right? That's how we look at it. So yeah, I'm very excited about the future, like the way we are doing the things which we are doing. And I think it's a good sign that in India also we are doing a lot of new technology trends to what we are looking at it. And yeah, we have great institutes where a lot of good people are coming out with excitement and knowledge that they want to share. So yeah, it's a nice space to be in right now.
Yeah, what are the hotbeds for AI graduates? Where are the AI graduates coming from in India?
Yeah, I think I have got a different trend on this. Like, it's not about the institute; it's about the background, which I look like a lot of people are doing it in IIMBs have it, right. Like in Bangalore, we have a good course for AIML. IITs have it. There's
Right,
now a lot of private institutions which are driving this. So we intend to look at like institutes like Indian Institute of Science who do some
right,
core research. We
right,
were looking at graduates from IMB who can take this core research and bring it into scale to the market. So it's
right,
going to be a combination of or associates from different organizations coming together that's going to help us grow with this. But
right,
yeah, I think that's how we look at it. Like even in India, we are now evaluating people based on the actual knowledge rather than just from there. Wherein we follow similar structure. For example, for somebody who's joined my team as a data scientist, he has to go through the same interview process which we do in our US counterparts there. So
right.
the bench scaling is same so that we get the same output. That's the kind of trend that we want to bring in. That we want to bring. It's difficult, right? It's different cultures, the different approaches, but we want to bring in the similar kind of benchmarking so that we can achieve similar goals going forward from there.
Awesome. So, to back what you just said, a lot of top tier investors here, they're looking at India to build startups in AI domain, and it's happening in cross border of ventures. I am involved in many such cross border ventures with Indian Institute of Science, Indian Institute of Technology, IMB. So I totally know that the talent is on par. They're almost catching up because AI institutes were formally declared last year in the US, and now you're saying in India they're getting declared. So they're almost happening at the same time. AI is
Mhm.
definitely a boon, and you're at the forefront of this technology in India and US. So thank you so much for your time. Any parting thoughts? You want to talk to the audience about? Any general thoughts you have before we take leave?
Yeah, I think my thought process is that innovation is a risky business, but that is where out of box thinking comes into place, and
Right,
that's where we culture the new ideas that people are thinking and then innovate. We will fail. It's okay to
right,
fail, but we have to fail fast and learn from that and take it
right,
forward from there. And
right,
AIML, if you're talking specific to that, it has gone through that repetitively. And
right,
we still have challenges that we want to solve and find some optimal solutions for it. But with the current challenges, there are a lot of them, a lot of those challenges which we are able to solve now with
right.
with the merger of technology and uh, cloud and IoT and all the things coming together. So I feel that we are at a very good phase wherein we can take this learning to a scale. We can we can make a difference for. I'm sorry, I'm talking more specific to healthcare because that's where I'm looking at. That
Sure.
I feel that there's a huge opportunity for AIML to make a big impact to the healthcare, how it is provided and where it is provided. So that's where I see us making a huge difference, and I think it's going to help indirectly the insurance people, the cost reduction in the hospital care that we are providing, and better quality of life for the patients at the end. So that's how I foresee all these things coming together.
Awesome, awesome, fantastic. So don't be afraid of failure. Fail fast and learn fast. Be open to innovation. On that note, thank you so much, Uttam, for coming on the podcast, and we wish you all the very best. Thank you.
Thanks, Vida. Thank you.
Thank you for listening to the podcast 10x Hacks for Startup and Venture Success. This is your host, Vida Patel. I'm bringing you interviews of investors and founders from Silicon Valley and across the globe. This podcast takes a lot of time and effort, so please support this by liking and sharing this post and signing up and subscribing to my podcast and my LinkedIn page on 10x Hacks. Thank you very much.